Very good afternoon. Welcome you all in this session of this diabetic retinopathy and the medical retina. Now I request Dr. Shankar Shubhra Chaudhary to present. Is there? Yeah.
A very good afternoon to respected judges and the delegates present over here. I am Shankar Shubhra Chaudhary, here to present a cross-sectional comparative study of the outer retinal layer thickness in newly diagnosed patients with hyperthyroidism. Greetings from RIO Kolkata. Now we all know that thyroid hormone is responsible for growth, differentiation, maturation, as well as apoptosis of normal cells. So it also is responsible for the growth maturation of the rods and cones, mainly the photoreceptor cells. Now, if a thyroid hormone is expressed morely, then there is excessive, leads to excessive photoreceptor both in healthy and diseased retina, whereas suppressing the thyroid hormone, there is a preservation of the cone cells. And this has been well established in a study published by Ma et al., which has shown that in Leber's congenital amaurosis and in case of achromatopsia in mice models, if there is a suppression of the thyroid hormones, then there is a preservation of cones. And this study has been the basis for my study. So the objective of my study was to assess the thickness of the photoreceptor outer and the inner segments in the newly diagnosed hyperthyroid patients and compare it with the normal population. Now this is the first kind of study ever done on human eyes. All the previous studies were mice models only. So this was a cross-sectional randomized study over a 6 months period in which 40 normal patients, normal healthy individuals were selected, and 40 newly diagnosed hyperthyroid patients were selected, in which visual acuity color contrast vision was taken, followed by a dilated fundoscopy, and they were then subjected to Heidelberg spectroscopy. The results we found that in normal population, 31 were female out of the 40, whereas in hyperthyroid patients, 33 were female. The mean thickness of the outer nuclear layer and the photoreceptor inner segment layer was 77.98 micron, whereas the thickness of the pigmented outer segment was 39.65 micron. Now in cases of the hyperthyroid patients, the thickness of the outer nuclear layer and the pigmented inner segment layer decreased from 77 micron to 71.83 micron, whereas the thickness of the pigmented outer segment decreased from 39 micron to 33.45 micron in case of the hyperthyroid patients. Now, in the group statistics, this decrease was significant, as we can see after the students' pair t-test. So the cone photoreceptors of the vertebrate retina mediate daylight vision, and these cones, we all know, are responsible for central acuity of vision, color, and contrast vision. Now, although the thyroid hormone signaling plays a major role in cone opsin expression and patterning, but a study by Lu et al. Showed that suppressing the TA signaling has no effect on the rod and cone structures. Whereas Glaske et al. Also showed that the suppressing of the thyroid hormone, there has been a thinning of the retinal photoreceptors in the study, as we have found in our study. But the limitation of our study was a small sample size. The hypothyroid patients were not considered in our study, and only anatomical assessment, that is, the thickness, was done. But a physiological assessment, that whether there is a color or contrast vision change, would have been a better study. So the technique message is that since cones play a significant role in maintaining a good vision, a thinning of the photoreceptors layers may be responsible for the reduction in contrast sensitivity as well. So there is an early detection in the changes of the retinal layers in case of the hyperthyroid patients may guide the physician to prevent significant vision problems. And another most important thing is, whenever we can see there is a thinning of the photoreceptors, a differential of hyperthyroidism should be made. These are my differences. Thank you.
Thank you. You have finished it in time. But my question is, what is the basic significance? Why did you do that study?
So because of all the previous studies were in mice models.
Yeah.
And they have shown that in cases of both in cases of hyperthyroid, there are studies on hyperthyroidism with mouse models and hypothyroidism. Mainly the study, there is one significant study in mice models with induced Leber's congenital amaurosis, Leber's LC and achromatopsia, which they have showed that if there is a suppressing of thyroid hormone signaling, the cone functions with LC and achromatopsia has been developed. So they have actually gained colored contrast vision for them. So this has been a basis for my study, which I am just shown that if anyhow we can modify the
Are
thyroid
the
hormone.
patients treated for thyroid disease or not?
For the mice models, they have been treated with thyroid, and both thyroid suppressants were given and CC agonists were also given.
Okay.
No human study has ever been done.
No, no. What is the result for that in the mice study?
My study, there is shown that with LC and with achromatopsia, the cone function has been bettered.
Okay.
You are telling that in any patients with the photoreceptor abnormality, you should think about thyroid. That was one line.
One differential
One
should
differential.
be
Don't you think
considered.
that is far-fetched? Because yours is a small group.
Huh.
And you get every CSR or every patient, you will get a photoreceptor.
No, sir. I am not. For CSR, there is obviously the diagnosis of CSR or for CNVM. But if we can see the more or less there is healthy retina,
Have
just
you
there is a.
all other diseases like CSCR, everything, when you included in the study?
No, sir.
So that is a big bias.
Any other question?
Huh?
Any other question? Thank you, Dr.